welcome to Nursing Research. This is Introduction to Nursing Research, the first chapter that we have for your class. Okay, I just would like you to know this is my declaration. The author of this presentation declares no conflict of interest. I have provided citations as appropriate. However, I want you to know that I was given PowerPoint presentation which was copyrighted by Persons Education Incorporated. So the copyright was last 2018. You will know that these slides came from Pearson because their slides would contain the Pearson seal and then the footer that says that it is from Pearson. So those slides, I do not claim ownership for those slides. Those came from Pearson's. Okay, just for the purpose of authorship. Okay, this is the copyright notice from Pearson that I am not supposed to share this unless that it is during our classes and then with the use of their textbook. Okay, so we'll be talking about the following topics: the significant and purpose, the methodological foundation, which is either quantitative or qualitative, and the knowledge and methods, and then levels of evidences. Along the way, I might be interjecting in our discussion my experiences in research. As a nurse, my background in research has focused in experimental research way back to high school. And then I also had quantitative research in my undergraduate and postgraduate. And then after that, I had experiences in qualitative research, okay? I don't claim expertise in any specific part of research. Hence, if there is any discussion of mine that was incongruent to what was previously discussed by your advisors, kindly let me know so that we can be able to settle on the best practices available to us. I am also informing you of my experiences in research for you to know what are the specific types of research that you can ask me. Okay, as a nurse researcher, I ought not to claim expertise again on all fields of research because there is no nurse researcher that is able to be an expert in all of these types of research. Okay, so my inclination is more on quantitative research. Now, let's start by defining research. Research is a systematic inquiry that uses disciplined methods to answer questions and solve problems. So take note there of the word systematic. Meaning, when you conduct research, there ought to be a process. It cannot be that I'll just conduct research because I just feel that I want to do it. Okay? For example, you might be wondering that your boyfriend just recently broke up with you and then you'll be saying, oh, I'm a bit depressed. Can I conduct research about depression after breakup? No, your personal experiences could be a source of research problem, but you could not just embark of research because of that. Okay, that alone. There needs to be a systematic process. And what we commonly call, you call your scientific method. Okay, and it uses disciplined methods to answer questions and solve problems. So take note that you have disciplined methods. So I could not just say that my research is experimental because I'm mixing some chemicals. There needs to be disciplined methods, okay? For example, in an experimental research, there needs to be 3 criteria for you to say that your research is experimental. You need to have the criteria R, C, and M. There needs to be randomization, there needs to be control, and there needs to be manipulation. Again, R, C, M. Randomization, control, and manipulation. Without these 3 criteria, I could not say that my research is experimental. So it does not mean that if you are mixing something, it's already experimental. It does not mean that if you're dealing with a certain drug, it's already considered experimental. There needs to be a disciplined method, okay? For those of you who have conducted a phenomenological study, I always find it hard to spell that one, okay? For your phenomenological study, a phenomenological study does not mean that you're only conducting an interview, okay? It does not mean that if I conducted an interview right now, or for example, I will be asking you on your lived experiences as student nurse related to the pandemic, hora, I already have a phenomenological study. It does not follow like that. A phenomenological study needs to follow disciplined methods, meaning there are methods given to us that we need to follow to the letter for us to know that this is indeed research, okay? Me asking questions to you about, kamusta experience mo sa MS, kamusta experience mo kay first time mo mag-research, that does not qualify as a qualitative study. So bear in your minds that there needs to be disciplined methods. And then the next part here, it is intended to answer questions and then solve problems. Okay, so I could not just conduct again a research and just say, are all people who had break up are already depressed? No. It needs to answer good questions and then solve problems. Okay? Your breakup might be your problem, but that is not the problem of the nursing research community. That is not the problem of the nursing community. That is not also the problem of the entire world. So not all of your personal problems can be brought to research. Okay? So when you're thinking of problems, for example, you might be wondering, since your seatmate is having body odor, and then you just thought that guava could be used for cleaning of wounds. So you might be wondering if guava could be used as a body deodorant. Okay, you might want to conduct that research. Efficacy of guava in reducing the body odor of your classmate. Okay, you need to think twice. Okay, does everybody have body odor? Is there no reliable alternative for the body odor? Okay, or if you will be introducing the guava, will people be entertaining the fact that guava could be used for body odor? Or could your guava compete with the existing market of deodorants available to us? Okay? So when you are thinking of a research problem, you might think that it is a very nice problem in your mind, but you need to think is this really necessary? Is this really feasible? And will this solve a very good problem that we are facing right now? Okay? Next, so this definition is from Pollitt and Beck. Pearsons provide us that nursing research is a systematic, objective process of analyzing phenomena of importance to nursing. So when I say nursing research, it also needs to be objective. Okay, it also needs to be objective. In your health assessment class, you are taught that everything that is gathered from the interview is considered to be subjective. So you might be wondering, oh, sir, there are qualitative researches, and most of the qualitative researches are being conducted through interviews. So how can I make these interviews objective? That is where the disciplined methods would come in. Okay? For example, in the phenomenological research, you need to undergo rigor, you need to undergo trustworthiness for your data to be considered objective. That's why a good nurse researcher would be able to isolate herself, would be able to isolate her personal experiences from that of the patients. For example, if I want to conduct a study on the lived experiences of patients, or let's say lived experiences of caretakers of cancer, if I have, or if you have a family member with cancer, and then you have experienced a strong personal or a strong emotional attachment to that patient, it would not be wise for you to conduct this research. Okay, if you are not able to separate your personal experience from the experiences of your patient, you will not be able to conduct a very good phenomenological or qualitative research. Because along the lines of conducting the research, it might be your own experience that you are interjecting to the patient and not the experiences of the caretakers or the patients per se. Okay? So despite the fact that this is done through interview, or despite the fact that this is done through case studies, there is certain degree of objectivity that needs to be practiced. So in research class, remove the notion that interview is subjective. There are research methodologies that would allow interviews to become objective. Nursing research would include studies concerning practice, education, administration, and nurses themselves. Now, if you have read the book of Tan, because I know you are advanced readers, the book of Tan would differentiate between research in nursing and nursing research. Okay, Tan is only among the authors I know that differentiates between nursing research and research in nursing. Now, Tan would say that research in nursing, okay, let's focus first on the second term. Okay, let's focus on the term research in nursing. When I talk about research in nursing, Tan says that these are researches about nursing. So let's say I want to know if the nursing practice right now is good or not. That is considered research in nursing. Okay, so when I say research in nursing, your topic is nursing itself. I want to know if the staff nurses in the hospital are stressed right now or not. This is research in nursing. I want to know if student nurses do appreciate online classes or not. That can be considered research in nursing. But when I say nursing research, I want to know if guava is effective for reducing the number of bacteria in the wound of my patient. that is nursing research. Okay, that is nursing research. For example, I want to know the level of anxiety of students in online, or if I want to know the level of anxiety of patients undergoing injection, that is nursing research. So again, if I say research in nursing, your topic is the nurses, the staff nurses, or anybody basta ang respondent mo is related to staff nurse, student nurse. But when I say nursing research, most of your respondents would be inclined to your patients. Okay, these are research related to healthcare. I hope I made it clear. Okay, the ultimate goal of research is to gain knowledge that would be useful for many people. Okay, it is not possible. Okay, it is not just, let's say for example, I'll search about um, hormonal changes related to love. Okay, that would not just translate into a research because that would not be just useful for many people. So your ultimate goal is to gain knowledge. Okay, gain knowledge. Where is my drawing? Okay, gain knowledge that ought to be useful for many people. Okay, take note of the phrase there, many people. If that will only be useful to you, think twice before you conduct or before you pursue your research. Okay, another definition from Pollitt and Beck. Systematic inquiry designed to develop trustworthy evidence about issues of importance to nurses and their clients. So as I have mentioned and differentiated by TAN, not because we are conducting research, we will only be focused in our patients. There are a lot of researchers that are also focused on nurses. Okay, right now, good topics are inclined in COVID-19. And mind you, class, if you have good topics in nursing research, you might be able to get financial support, okay, financial support from government agencies. For example, the OST could supply for your research. Department of Health do also supply for research. Commission on Higher Education would also supply for research. There are also private agencies would even supply for research of about up to 1 million or even 5 million to 10 million if we are talking about drug-related research. Okay, so here are the research as a scientific process. By the way, if you have questions along the way, just press the raise hand button there. Okay, so research as a scientific process ought to determine or describe an existing situation. So it ought to become a situation analysis. For example, right now you have COVID-19. You might have noticed that there are a lot of depressed people. I could not just say to the world as a nurse that COVID-19 leads to depression. Okay, that is not a valid conclusion. I need to conduct a research. I need to conduct a research to understand the situation. So that's why your research is focused on situation analysis. So right now, for example, if you want to conduct studies on COVID-19, I don't want you to say or have a research question which says, what is the impact of COVID-19 to people? That is a very vague research question. But instead, if you want to know what is the impact of COVID-19 to the mental health of people, that is also a vague question. Why? Because of the term there, people. You could not just study everybody in the world. You don't have the time to study everybody in the world. So to narrow it down, you might say, what is the level of depression of student nurses, okay, in a private school during the times of COVID-19? That makes it more specific. Sometimes in the conduct of research, we tend to become ambitious, okay? As if we would want to know everything, we would want to know the level of depression of all those people in the world. Okay, we appreciate you being ambitious, but you also need to become realistic. You do not have the time in the world to conduct this research. And do not be disappointed if your research would be limited on a certain group of people, because that research of yours could serve as a springboard for the conduct of future researches. Okay, next, describe a population. And that population could be people, it could be object, it could be the institution. Okay, people, object, institution. So people, example is studies conducted among student nurses. Object, for example, if I want to study about drugs, that could be a study in objects. And then institution, okay? Researchers right now would allow you to conduct a study in a certain institution. For example, among the batch that were able to graduate, there was a study on I'm not sure if it was a home for, yung parang Bantay Bata 163 or something. Bantay Bata 163. Okay, or something like, it's a group or an institution that caters for children who have no homes, okay, or no respective homes. So they were able to conduct an institutional case study. Okay, they were able to conduct an institutional case study, okay, on this specific institution, and it was considered to be a research output. Okay, that type of research is actually classified under qualitative, that is subclassification is case study. Okay, compare two conditions or groups. For example, if I would want to compare, okay, who performs better? Is it section F or section H? I might be able to conduct a research to that, okay, to that effect. Okay, although it's not really an ethical comparison, but just to give you an idea. Okay, allow me to give you an example of a research on focus. So most of the researches here that I'll be giving as an example are researches that I have conducted, okay, or along with my team or along with my group mates. This is my undergraduate study. I must admit, it is not really a good research. It's not the best that I can share to you, but this study has focused on health and accident emergency management, okay? Health and accident emergency management. Our initial proposal for this study was, we just would want to know if teachers are knowledgeable on doing first aid. Okay? We know for the fact that there are a lot of people, okay, or there are clinic nurses, or what do we call them? We have school nurses, okay, to that effect. But the first person that would encounter the student in terms of emergencies would be the teacher. So our research is focused on, does the teacher know what to do by the first time that he encounters somebody who had a seizure, somebody who had a severe bleeding episode, somebody who lost consciousness inside her classroom. So that was our focus. And our argument was, to defend our title, our argument was, yes, there are school nurses. However, school nurses are not the first people who see these patients. And our focus is that we do not want the teacher to manage the student, but at least we would want to know if they know what are the first things that they need to do. Okay? We were surprised to know that there are still teachers who would ask the student nga magtanga if ever there are episodes of epistaxis. There are teachers who would admit that during the time of their when they encountered these patients, okay, for example, they encountered somebody who is severely bleeding, they will just run the child to the clinic without even applying pressure. Okay, so our research has focused on knowledge, attitudes, and practices. At present, okay, knowledge, attitude, and practices study are difficult to defend because the panel would usually ask, why do you need to know knowledge, attitude, and practices? Knowledge, or knowing knowledge, attitude, and practices alone would not change anything unless you have a very good problem. Okay, unless you have a very good problem. In our case, we found out that most of the teachers would be anxious when they have these patients. Okay, if they have, for example, students who would have seizure episodes during their class, instead nga magtawag sila sa clinic, magtawag ambulance, sila pa ang una nagakalipungan or sila ang una nagasala-sala and nagakakulbaan. Okay, so in reference to our discussion, you can know in this study that we have made a comparison. Okay, we have made a comparison between public and private schools. We have made a comparison among those teachers with greater than 10 years of experience and those with less than 10 years of experience. Okay, it turned out that those in the private school would have more positive attitudes towards emergency management compared to those in the public school. In introspect, okay, one of the things that we were trying to explore is that in the private setting, they are more confident because of the perceived availability of resources. Okay, but in our study, that's not the conclusion. That is just a recommendation for further study. Okay, so this is just an example. Now, also, it were able to determine the existence, degree, or nature of relationship. The most simple example for this one, maybe for the relationship, is I would want to know if what is the relationship between the number of hours of your study and then your grades in MS. Okay, that's the elementary example for that. Okay, I would want to know the relationship between the number of hours that you are dating and then number of hours of dating, and then the number of years that you would have in your relationship, for example, with your boyfriend. Okay, those are the examples. Okay, relationship. Okay, in relationship, take note that not all studies could be relational. Not because I am comparing your educational attainment and then your grades in MS, or let's say, for example, educational attainment and perceived success in life, that is already a relational study. Okay, so you need to be mindful with that. Not all the time that you are comparing scores, it is a relational study. Anyway, you will have a deeper discussion on that on the succeeding chapters. Okay, so relationship. Maybe the most common tool that you have encountered in your undergraduate or in your senior high school years is the use of persons are. You might also heard of the use of chi-square, okay, gamma, and then I'm thinking of other tests. Okay, you encountered Mann, Whitney, and then you might have encountered Kruskal, Wallis. So these are tests that are used for the test of relationship. Okay, so these are tests for relationship. If you see studies which use t-test, okay, z-test, and then ANOVA, you might also have heard of Mancova. If you did not hear of those terms, it's okay. Okay, you will be hearing that sooner enough. Just to give you an overview, these terms are usually used in comparative studies. Okay, so when I say comparative studies would focus on the test for differences. I want to know if who is more intelligent, male or female, when it comes to mathematics. That is a comparative study. But if I want to know the relationship between your income and then your perceived benefits of online classes, that is a relational study. Okay, so comparative and relational. Next, evaluate and compare effectiveness of intervention, treatment, and exposure. So if I want to evaluate, compare effectiveness, intervention, treatment, or exposure, this is more on experimental or pre-experimental types of research. So if I want to compare an intervention, let's say, for example, what is more effective? My undergraduate study, for example, focus on petchay. Kahit daw vegetarian pa ako sa high school ako class. Okay, so for example, I would want to know if what is more effective. It is the organic fertilizer, or is it the inorganic fertilizer, or no fertilizer at all? This is a comparison of intervention, treatment, and exposure. Okay, my study was, I think it focused on the effectiveness of organic and inorganic fertilizer in the growth of Brassica napus. Okay, Brassica napus is the common petchay that we are using. Okay, the one that you can find in the market. Okay, if I want to know if what is more effective, it is the guava deodorant or the banaba, not the babana or the banaba. Okay, for example, banaba. Okay, for example, banaba deodorant or whatever you call that fruit. If I want to know if what is more effective between the two of them, that is comparison. Okay, that is the type of research that you will pursue. Next, predict the value of certain characteristics. Okay, predictive research has becoming more common nowadays. So when I say, for example, if I want to predict your success in the nursing program, will your NAT scores be able to predict your survival in the nursing program? That is a predictive study. Okay, there are studies like that, for example, which would say that your performance in the board examination can be predicted by your performance in your nursing aptitude test. Okay, or let's say they will say 50% of your scores or 50% of your probable score in your board examinations can be predicted by your score in your nursing aptitude test. Okay, that is an example of the predictive value. It may sound difficult, but actually it just entails complicated statistics. But if you are able to gather your data thoroughly, you will be able to conduct a predictive study. Okay, again, another research on focus. Halandoni's research was, he was my advisee in Master of Arts in Nursing. He was also major in medical surgical nursing. He was among the 3 that graduated among my advisees in Masters of Arts in Nursing. His focus was predictors of clinical outcomes in cardiovascular intervention patients. Okay, I will not be elaborating on the results of his research, but it goes something like, okay, When I say cardiovascular intervention, just to give you muna a background, okay? So when I say cardiovascular intervention, recall that part when I have shown you a slide which shows that a catheter is inserted to the heart of the patient and then the clot is being removed. Okay, that is a cardiovascular intervention. Now, if you have patients class undergoing cardiovascular intervention, I just do not say that all of my patients with MI will go cardiovascular intervention. Because later on in MS, you will realize that not all of the patients will be helped by cardiovascular intervention. Okay? What do we mean by that? For example, if you have patients who are very old, if you have patients who have bleeding tendencies, if you have patients who have a lot of comorbidities, okay, nga ang cardiovascular intervention mag-help sa patient mo. The cardiovascular intervention might be the fastest way for your patient to rest in peace. Okay? Meaning, before ang patient naton mag-undergo sang cardiovascular intervention, the doctor would evaluate first the patient if he is suitable for cardiovascular intervention. So the study here of Patrick Calandoni focused on the predictors of clinical outcomes. Okay? So we found out that if your patient has a renal problem, if your patient had a previous incident, for example, of myocardial infarction, their risk for mortality after the procedure would already be increased. Okay? So if you have seen in the hospital setting, you will encounter in a while, you will encounter patients or doctors who will say, "Ma'am, if ang imo nga patient would undergo surgery, ang pakadtuan sini hindi kami kapasalig if he will be alive or not." Okay, if your patient will undergo cardiac intervention, your patient might have only 30% chance of survival. So that 30% chance of survival is not determined by haka-haka. It's not determined by just some preemptive thoughts of your physician that is based on research. Okay? So after this research, for example, of his, after supposedly may future pa kami nga plans, so if ma-materialize ang future niya nga plans, he will be able to formulate a formula in such a way that if i-input mo dira ang age ni patient, i-input mo ang creatinine ni patient, i-input mo ang scores niya in a certain kind of test, we will be able to predict the chances of death of the patient. So what's the significance in clinical practice? At least you will be able to know that what will be the possible outcomes if your patient would undergo this surgery. Tawag balaklas nga, most of the family members in a Filipino setting are willing to pay millions as long as you can assure them that these millions of them will be going towards the survival of their patients. Okay? Even if they do not have that millions, they are willing to have debts, willing sila mag-utang, they are willing to have their lands sold, okay? As long as you can assure them that this would lead to survival of their patients. Okay, so these are among the good studies that we were able to conduct, predictors of clinical outcomes. If you want to pursue this kind of study, okay, it's about time for you to read about regression, analysis, and then multiple regression. Okay, these are the statistical tools that we use for us to understand or for us to know the impact of this research, regression analysis, and then multiple regressions. Okay, importance of research to nursing again. Many people are unaware nurses conduct research. Okay, so many people do not know that nurses also conduct research. Some people think that because we are nurses, we are just in the hospital setting. Mind you, class, the money in research is very good. Okay, although I do not want you to be motivated by money alone, but I would want you to consider, okay, conducting research because of the financial implications. Okay, for example, in my case, I've traveled to many places for minimal expenses because of research. Okay, nurses must seek opportunities to discuss research and make results available to the general public. Okay, hindi na nga pwede, class, for example, no, balik naman kita sa hugot nyo bala sa academic freeze. You could not just make a hugot for the academic freeze and then just say, ma-academic freeze kita because that is what is beneficial. Okay, as a nurse right now, because you're imbibing in research, you need to conduct a research if you would want to pursue academic freeze. Okay, And your research could not be like, do you want to have academic freeze? You could not ask questions like that. Instead, you might be able to focus on the socioeconomic status of the Filipinos. You might want to focus on the internet connectivity issues of Filipinos. And then from that, you can make recommendations on your academic freeze. Okay? You might also want to know if what is the general pulse of the public. Would the public really want to have academic freeze? Or look at it right now. I did not even expect that for the level 1, we will have 9 sections. Okay, I was actually expecting that there will be a decrease in the enrollment of nurses or student nurses because of the pandemic. I was even thinking, oops, parents will not be sending their children to school because of the pandemic. But ironically, as you can see, there are 9 sections right now for your first year. Okay, so meaning people would still want to take nursing. So, okay, evidence. You want it to be available for the public. Research and evidence-based knowledge from nursing were identified as basis for practice. So now is not the time for us to say that when you are doing your rounds, you carry a lamp because Florence Nightingale used to carry a lamp. Okay? Now is not the time for us to say that we need to give this medication because Lola says that this medication is effective. All of the things that we are doing right now in nursing should be evidence-based. Okay? It should be evidence-based. And then, nurses must take the lead to communicate results and encourage use of research findings in the practice settings. Look at this part. Okay? You might, not might, you need to take, you need to take the lead to communicate results. Okay? One thing that I want you to put in your minds is that I don't want you to conduct research just for the purpose of submitting your research and then have it inside the library, in the College of Nursing, and inside the Henry Luce Library. Okay? So, what's the relation to that, to the last bullet here? I would want you to make it a goal to communicate your results. If there are opportunities for us to go abroad to present your research, we will be grabbing that opportunity. Okay? So, make it a point that your research is scholarly, your research is done with all integrity in such a way that if we will be presenting your research later on, may that be locally in other provinces, nationally, for example, or abroad, okay, we will not be ashamed of the research that you have conducted. Okay? It is very unfortunate that there are a lot of poor researches being presented abroad, okay, even from the Philippine setting. So if I tell you that as a student, there is really a very good tendency for you to present your researches abroad, you can really do it. Okay? So I want you also to put that in your mind as a possibility in the future. Right now, class, presentation international is very possible because of the online platforms that we have. Sang una, mag-international kami. Okay, the international presentation I have attended, for example, was in Japan. Okay, we need to spend a lot of thousands just to attend the conference. But right now, you can attend conferences in other countries, okay, online. Timambal ka mo ahay, sir, online. Class, the goal in research is for you to communicate your results, okay? Whether you found out that broken-hearted people would have depression, that will be useless if you are not able to communicate your results to nurses, psychiatrists, doctors, and other professionals. If you want your research to make an impact, even just to a small population, you need to be able to present your research. So I want you to make that a goal for your research class. Okay? Next, research knowledge will help you become an excellent nurse. If an intervention is not based on research evidence, there is no way to determine that the intervention is an optimum one. Okay? So nagay ka mo ambal nga, amo gini ang pinakanami ng intervention. This is the best intervention for my patient. If there is no research to that effect, okay, wag mo nang ipaglaban, class. Okay? This is the time just for you to keep quiet because there is no research about that. Okay? That's why if we argue or if we make jokes among researchers, usually at the end of our arguments, we will just say, do you have a research to that effect? And then a nurse researcher would just keep quiet if you know that there is no research to that effect. Okay? Functions, answer questions, solve problems, and make decisions. See and understand how and why a situation or problem exists, and then discover new things and data. So that's among the functions of research. So for example, in a phenomenological research, we would want to know the lived experience of those people who have unique experiences. Hindi man niya class pwede nga ma-interview ako qualitative, tapos mahambalang ko nga, ti kamusta experience mo sa paggamit mo sang cellphone mo nga bag-o. Okay, I need to have good studies or I need to have good problems that I need to understand. For example, among the recent problems that we have approved is experience among andropause. Our argument was that ang menopause ya pirmi lang ginatun-an. Ti kami ya, kaya nag-experience man kami andropause. Okay? Or another way of stating it is, we have studied a lot about menopause, so it's about time also for us to understand andropause. Okay, we also have, among those students who have already graduated, we have a study among blind persons. Okay, what were their lived experiences as blind people who previously they have normal vision and then they became blind. We also have a qualitative research on the lived experience of single fathers, or what do you call that? Single fathers. Okay, fathers who are acting as single parents. I think it's driving on the same point. So we have phenomenons like that. Okay, para sa inyong qualitative researches. And then we want to discover new things and data. Okay, so another research on focus. So we have factors associated with quality of life, and then among children with epilepsy in Iloilo City. This is my masteral research, which I was able to finish in 2017. So this one, my attempt here is to understand what are the factors that affect the quality of life among children with epilepsy. Okay, you know epilepsy, commonly referred to as kuya. Okay, there are people kasi class, my argument here is that there are people or there are parents who would not be sending their children to school because they have epilepsy. They are afraid that their children will have attacks in school, their children will have attacks while they are walking, which is indeed true. That could possibly happen. So my study tried to evaluate on the factors associated with the quality of life. And class, among the major factors that I found out is the schooling status. I found out that those children with epilepsy, okay, the old term for this was epileptics. Okay, epileptics daw is not politically correct. It's not politically correct to refer to them as epileptics. That's why the term for them is CWE, children with epilepsy. Okay, so I found out that those students or those children with epilepsy who go to school have higher quality of life compared to those students who are not going to school. Okay, also one of the factors here is compliance to medications. Those patients who comply to their medications have good quality of life compared to those who do not. Okay, so the purpose here is to generate knowledge. And then what did I do with my research? I tried to give this to a neurologist. I shared this to a pediatric neurologist just for her to include it on the counseling. I've talked last time to the pediatric neurologist. She is planning to conduct another research as a secondary to my research. Also, I've shared this to an adult neurologist and I presented this to other fora nationally. Okay, so generation of knowledge. Then, validate existing theories or generate new ones. Okay, when I want to validate existing theories, take note that if you are conducting quantitative researches or most of the research, it is grounded on a theory. When I say existing theory, you can work on any theories that you know as of this time. Okay, it is curious, class, that there are very few people or student nurses who would conduct research related to nursing theories. Supposedly, nami gitani if you are testing nursing theories. Okay? However, there are very few people who would conduct research on nursing theories. So, I would like to urge you, if you would want, for example, to check Johnson's theory. Anong theory ni Johnson gani? The behavioral systems model. If you would want to check Florence Nightingale's theory, you can use this theory as the conceptual basis of your research. Okay? For example, you want to know the impact of the environment in the survival of patients with COVID-19. You can anchor that to the theory of Florence Nightingale because you know that the theory of Florence Nightingale talks about the environment. Okay? Things like that. Or for example, if you want to know the 14 basic needs, which among the 14 basic needs elaborated by Henderson, if I'm not mistaken, okay, is more vital right now in COVID-19, you can use the theory of Henderson for your research. Other theories commonly tested. Ang common ginatest are Maslow's hierarchy of needs. That is a very common conceptual theory being tested. Also, we have, I'm thinking of health belief model. Just search if who is the author of health belief model. That's also among the first, among the common theories tested in research. So for example, if you want to know the impact of, if gusto ko mabalaan ang influence of perceived mortality on COVID-19 and intent to test for COVID-19. Okay? I want, for example, to know the relationship between perceived mortality due to COVID-19 and then their intent to test. So meaning bala, if the person perceives that they will die of COVID-19, are they likely to test for COVID-19 or hindi na lang sila magpa-test kay mapatay man sila gyapon? Okay? If you want to test something like that, it's usually the health belief model, because the health belief model states that if the person believes that this has a big impact on their health, they are more likely to do something to address that health problem. Okay, so it's grounded on theory. Then the next point there that I have is to generate new ones. In your practice, okay, you can generate new theories. I'll be showing you a research later on that I tried to generate a new theory. If you would recall all the theories that you learned in your philosophical or your theoretical foundations in nursing, these theories were actually brought to us by research. Wala na klas nagpalagpat si Florence Nightingale kag nag-ubra-ubra sang bintana, sunlight, kag pagkaon para ibutang dira sa theory. It's grounded on research. So as si Sister Calista Roy, she had conducted research just for her to know the adaptation model that we are talking about. Okay, those are all grounded on theories, just like your Abraham Maslow, just like Erik Erikson. All of those theories are bounded on research. Okay, identify cause and effect of the situation and phenomenon. Now, on the cause and effect, for example, if your research would find out that, nursing students, for example, are more intelligent than engineering students, okay? Do not make a conclusion of cause and effect, okay? Take note, a relational study does not entail one to make a cause and effect conclusion. So if, for example, your study found out, student nurses are more intelligent than engineering students when it comes to mathematics. Do not make a conclusion that, okay? Do not make a conclusion that the course would affect my knowledge in mathematics. That is not what your study is intending, okay? You just know that there is a relationship between the course and then there's course in mathematics. But you cannot conclude that if all the students would transfer in nursing, they will become intelligent in mathematics, okay? A cause and effect relation or a cause and effect could only be concluded in research if you have the higher level of evidences. That is because of RCT. We'll talk about RCT. I'll touch RCT later on. That is if you have meta-synthesis and then you have meta-analysis. Okay? If your study is only relational, do not conclude that it has a cause and effect relationship. This is the most common fallacy or error in quantitative research. Okay? Kalabanan ma-conclude nga, we go to nursing para mag-alam kita sa math. So it's not like that. It's only relational. Okay? This was one of the studies I've conducted with my advisee in Master of Arts in Nursing. This talks about theory generation. The methodology being used for this research is what you call your grounded theory. Okay? Grounded theory. Okay, grounded theory is an advanced methodology under qualitative research. If you would want to embark on that, okay, you can do so. So our focus was to determine the indices of nurse manager competencies in Iloilo City. When I say nurse manager here, class, a nurse manager could be your head nurse. A nurse manager could be your supervisor or it could be your head nurse or supervisor. What we want to know is what are the factors or what is perceived by many to be an effective nurse manager, or what does it take to become an effective nurse manager. So there are a lot of inputs from other literatures, but there is no fixed guidelines for us to say that somebody is an effective nurse manager. So how will we be able to do that? So we have these indices of nurse manager competencies in Iloilo City. This is our study. And look at the product of our research. Just like the theories generated by your nursing theorist, okay, we were able to make a diagram to illustrate the findings of our research. Okay, plus the circles there have their respective meanings. There is a reason why there is an oblong there. Okay, I will try to explain one point. Okay, for example, for this one, constructive performance evaluation is considered a very crucial part of workforce empowerment. Okay, meaning when I say performance evaluation, it needs to be constructive. When I say constructive, we found out in our research that they do not want nga ginasuyaan sila or ginadimin ang ilang personality if you are evaluating them. For them, this is crucial for you to have workforce empowerment. Okay, that's one factor. Now, you might be noticing that these circles are overlapping because during our interviews with the chief nurse, the nurse manager, and the staff nurses, we found out that these skills are interdependent with one another. Okay? For example, for the workforce empowerment, hindi gali pwede class nga ang head nurse, ga-empower lang sang workforce, pero hindi pwede or hindi kabalo maggamit sang computer or hindi kabalo mag-ubra sang schedule. So for all of these three people here, the chief nurse, nurse manager, and staff nurse, they agree that there needs to be a technical expertise for them to have workforce empowerment, for them to empower their staff nurses. Okay? I will not be discussing the entire model here, but the big message here is that this model was generated because of series of interviews from these people. Okay, I think we have interviewed here 15 staff nurses, about 15 nurse manager, and then 8 chief nurses. All of those interviews were transcribed. When I say transcription, that means that the entire interview is being typed. Okay, and we analyze all the statements there of your interviewees. Okay, that might be tedious. And then interviewing them alone may take time. Okay, for our interviews with the chief nurse, that's at least 1 hour per chief nurse for initial interview. And then you need to do follow-up interviews. Okay, and then what else do I want for? So this is for your grounded theory. Okay, this is a grounded theory. Our main attempt here is to test or to generate a new theory. So I formulated this with Mr. Dalisay. Mr. Dalisay was actually a graduate of CPU also. He is batch 2012. He became an advisee in thesis writing, and we were able to generate this theory. Supposedly, as a future direction for research, okay, we should be testing on this theory.